All right, you got my producer Joe. Thanks, Joe.
You're welcome.
5 important tips for back pain, exercises, and herniated disc treatment. It's very important to strengthen your spine. And what I see a lot is patients have the wrong idea about what the goals are for their spine and end up doing things that make it worse. We've been doing this for 25 years, 26,000 patients, over 500,000 treatments. We've learned a lot along the way. These are 5 tips that you must know if you're going to do exercises for your spine. We've done several studies that have been published in medical journals, and we validated that this is the best way to solve your back problems. When you have back pain that's not going away, or chronic back pain, it's not uncommon that you have a problem with your disc. The disc needs to be stabilized and secured inside the spine. And when the muscles don't work the way they should, or the joints aren't working the way they should, the disc will start to break down. So the disc is a lot like a jelly donut in the sense that the outside of the disc there's a thick material, and inside the disc there's a jelly. What can happen is due to a load, compressive load, bending, lifting, twisting, is you can start to push the nucleus in one direction, and what it does is it starts to cause a tear in the annulus. And as the annulus tears, the nucleus will start to migrate out, developing what's called a bulging disc. It'll migrate out further, sometimes called a herniated disc, and sometimes it pushes all the way through the outside. That's called an extrusion. So the disc can start to break down. Also what happens is the disc can degenerate. And as it degenerates, the vertebrae get closer together. But these processes will develop inflammation. So when you have a tearing of the annulus, you'll develop a little inflammation. Okay, with the bulging disc, the herniated disc, and the degenerated disc, these all result in inflammation. Our goal is to do exercises to maintain stability of the spine. The key is to avoid too much motion on this tear or on the degeneration. And the way you do that is build stability. So these 5 tips are about what it takes to build stability, because what happens is people do it wrong. The key is to avoid aggravating the tissue and letting the tissues heal. When the tissues heal, you feel better. When they don't heal, you continue to have the problem, and very often it gets worse. So it's not uncommon that you're doing the exercises thinking you're making yourself better, and you're actually making it worse. The goal is to distribute the load evenly in all directions on the annulus and through the work of the muscles. Stability, strength, and motion. Number 1, do the exercises every day. Don't overdo it. Don't do too many. You have to do enough where you're not aggravating the tissue. So do a little bit every day. Sometimes if it's real unstable, you have to really go slow. The more pain you have, the slower you have to go. You want to avoid doing the exercises first thing in the morning. What happens at night when you're sleeping is the discs tend to fill up and get a little bit stiff. Our goal is to avoid too much motion on the aggravated disc, to avoid the motion on the tear in the disc. So in the morning, if you're stiff and the disc is inflamed, you don't want to put too much motion on there. So you don't want to do it first thing in the morning, but you don't want to do it late at night, because you do not want to do the exercises when you're fatigued. So the best time really is from mid-morning till dinner, maybe a little after dinner, but don't do them right before you go to bed. Because again, it's that tear. We're trying to eliminate the inflammatory process. We're trying to build stability around the spine. Too much motion causes it to get worse. Part of our process is avoiding the activities that make it worse. Very, very, very important. Next one. How many you do and how often you do them is based on how bad the pain is. So the dosage of your exercises is based on how you feel. If you have a lot of pain and it's really hard to do, then you do a little bit throughout the day. Some people do it 4 times a day, but you do a real little bit. And then as you start to feel better, maybe you break it down to 3 times a day and then twice a day. And when you feel stronger and there's less pain, then you do it once a day. The key is strength and stability. So dosage, you don't want to overdo it. When you overdo it, you start to develop problems. Another thing, I did a video about this. Okay, bracing. Bracing of the muscles. When you do the exercise, you want all the muscles of your core to be contracted a little bit, because what we're trying to avoid is this motion to the spine. Okay, if you're doing motion to the spine exercises, you're going to aggravate the disc. So we do bracing. Bracing is when somebody punches you. Somebody punches you, all the muscles contract. Okay, hollowing is where you bring your belly button in. What we want to do is bracing. Why bracing? Because we don't want to bend the spine. The key to these exercises is to build the strength and stability. So you have to maintain a proper brace. Okay? Because it's about the muscles of the bracing and the stabilizers. It's not about any other muscle. That's the goal of back pain muscle strengthening exercises. I got it. And you want to maintain a pain-free position. You want to put your spine in a position that doesn't hurt. Again, that little tear in the annulus or the disc degeneration, there's an inflammatory process. And if you move into positions that make it worse, you increase the inflammation. So you want to maintain a pain-free position. And then the goal is to move around the joints. Not the spinal joints, but the big joints, the ball and socket. Got a ball and socket here and ball and socket in the shoulders, okay? The motion through those joints is designed to be maintained through the spine. So you don't want the spine to rotate, you don't want the spine to flex, extend as you're doing the exercises. That defeats the purpose. Again, we've been doing this 25 years. We've solved some of the most severe back pain on the planet. We can get rid of back pain. We know what has to be done. Sometimes simple exercises make a big difference. And avoiding the activities that make it worse make a big difference. Again, sometimes you don't think it's going to get better because you tend to do something that makes it worse. If you do the exercises wrong, you're going to make it worse. There's an anti-inflammatory nutritional supplement that we use. It's very, very, very important. Combination of anti-inflammatory nutritional supplement, not the medication, because that'll make it worse sometimes. In conjunction with the exercises, makes a big difference. We have 11 super nutrients. One's designed for anti-inflammatory. Multiple are for antioxidant. The disc, as it degenerates, is an oxidation process. We have some specifically for the discs and the joints. We did one the other day about glucosamine sulfate and how it actually rehydrated the discs. Very important, super important. We have nutrition for the nerves. We have nutrition for the blood flow. We have nutrition for the bones. We have nutrition for the muscles, okay? We have these together in a packet. Combination of exercises with the nutrition, you can get your life back. That's the key. The key is to live pain-free. I want you to like this page. I want you to subscribe. I want you to share it. And if you have any questions, ask me questions. I'm here to answer questions. I know I've been super busy in one of the clinics lately helping out. We've been really busy, so I haven't been on as much, but we're going to try to get back on more. And if you want the nutrition, you can go to this totalbackpainrelief.com, 11-nutrients. Okay, it looks like this. And you know, we'll put the video for the 11 nutrients on there as well. So please share this information. We're here to help. We want to solve back pain on the planet. You don't have to live with back pain. You don't need surgery. And you certainly don't need the opioids. That's it. Have a good day. Be safe. Be careful.